Hi, I'm Hudson Garrett, Adjunct Assistant Professor of Medicine and the Division of Infectious Diseases at the University of Louisville School of Medicine. And I'm pleased to bring to you this August Aerobotics Clinical Newsletter article. The CDC recently released a progress report from NHSN that showed progress towards healthcare-associated infections. And while some may be celebrating this, I particularly am not. Because as a patient and a caregiver, I think that anything above zero is not something to celebrate. It's something to say that we have to build more reliability, more compliance-related strategies, and we have to dig further into what we can do to actually reach, achieve, and maintain zero. Our patients, our caregivers, and our communities deserve this. As someone who is taking care of his father, who's actually suffering from Parkinson's right now, healthcare is really important to me on a personal level. It's something that I've witnessed on a level that has been very, very life-changing for me over the last 12 months. I recognize the value of things like hand washing, disinfecting surfaces, making sure my air, my water, my food is safe. Even with the most recent foodborne outbreak that's impacting many of our states across the United States, we have to take for granted that some of the things like food service workers are being done correctly. This brings to question the value of the core practices of infection prevention and control. Basic things like practicing aseptic technique, making sure that we're monitoring the safety of our air, our water, our surfaces, that we're practicing hand hygiene, using personal protective equipment appropriately, that we're having good leadership engagement in everything that we do. Each of these practices is fundamentally important to not only reaching zero healthcare associated infections, but more importantly, maintaining them. Keep in mind that our patients, when they enter the doors of a healthcare facility, whether it's an inpatient environment or outpatient, they have one core expectation. They want safe, reliable, and cost-effective care. And they want to leave our building in the same or hopefully better condition as we found them. And I think that's a realistic expectation that they should hold. It's something that we should all personally take. We should make sure we hold it close to our heart and we should make sure we deliver upon that care, keeping surfaces, hands, the environment, the patient's skin, and the air as clean as possible. I look forward to seeing you for our next upcoming article.